Good morning, everyone. At the outset, I would like to thank the AIOC Scientific Committee members and the ISMS ICS for giving me this opportunity. Very interesting videos all throughout the session. Mine is purely basics, and I'll try to make it more interesting. Let's see, my topic is art of Capsulorhexis, no financial disclosures. So to talk about the Capsulorhexis, first I would like to tell you, we'd want to have a clear view of the field during the procedure of the Capsulorhexis. We should clearly understand the pressures which are involved in the eye. We should be understanding the forces during the procedure of the Capsulorhexis. So when I talk about the clear field of view, what I mean is actually aligning the head of the patient to the objective of your microscope and utilizing your red glow to a proper extent. There are other aftermarket things to enhance your red glow, especially the Omni Glow and everything. You can see in the picture the difference actually when you switch on an Omni Glow. This is something which you can also use. You also should be mindful of the stagnation of the fluid. For example, in a peribulbar anesthesia and stuff, you would see there will be a ballooning of the conjunctiva, which you want to take care of it by removing the chemosis. You can either puncture the conjunctiva and then remove the fluid out over there. Here the main criteria is to make your field viewer, if there is any meibomian oil or anything like that over there coming across, clean it up, keep some amount of viscoelastic and take care of it. Now when I'm talking about understanding the pressures, I'm talking about even the visco which you're injecting into the eye. Make sure it's the optimum way of injection. I mean not more, not less. As you say, when you make a dish, it's the optimum amount of salt. It's the exact amount which is needed. If you make it more, the iris, there's a lot of pressure. The iris will try to come out. When you insert a Capsulorhexis, a forceps or anything, a lot of visco will come out. And if you go under, also it would be a problem because you would not be actually having a good clarity, and also you would not have enough pressure to do it. To go back, when I talk about the pressure, the psychological pressure, even I want you to be in a comfortable position. Your hand, for example, if you're making an incision completely a little away from that, you can make an incision, but when you're trying to revolve your rhexis needle, your hand as such, your wrist joint, if it's overstretched or inside like a flexion, you cannot make that circle. Make sure it's in a comfortable position where you can actually make that circle and the axis is actually aligned to the incision place. So when there is a lot of pressure, you try to depress the incision, and also a lot of visco will try to come out. Additional things which you can aid for, it's actually, if the pupil is smaller, you probably want to use like a BX ring or iris hooks to increase the field of view. You can also use enhancing devices. If it's a mature cataract, you could use something like a trypan blue. For example, when you see in this video, I just want you to notice once it's a mature cataract, you're probably using over here a trypan blue under the guide of air, and then making sure you put good amount of visco from the other end so that it actually clears off the anterior chamber, no ripples or anything over there. Preferably, these are the instruments which I use. There are a lot more instruments. When I'm talking about the instruments, the top one you see is a cystitome critically, and it has two bends. The first bend is usually I make it not completely vertical nor acute, a little obtuse, probably around 110 degrees and so. And the second bend is basically dependent on how the surgeon holds it. It can be a little obtuse, anywhere between 100 to 120. It depends on how the surgeon holds the Capsulorhexis needle when he's doing. The other thing is a Capsulorhexis forceps. This is, you can also use micro Capsulorhexis forceps. These are the two things which I usually use, and so that's what I'm showing it over here. A typical mature cataract. I want you to observe over here when I'm making the incision, and then I'm trying to take it to the periphery to increase it dimension, and then see I have a difficulty in getting it back, so I'm applying a force towards inside. I would like to discuss about these 3 points in the next slide. These are the points of relevance. The topmost slide when I've actually used it. So you have to remember the capsule as such has some inbuilt potential energy inside it. As soon as you make the nick, the potential energy is lost. But now there are a lot of extrinsic factors which actually involve in this. The fluid, for example, if it's a hypermature cataract, there's a fluid which is coming out which will create a lot of radial force, a centrifugal force to actually cause the radial tear. You also should, the zonular complex can also cause a peripheral tear. So these extrinsic factors should be negated by the surgeon's extrinsic factors to get a perfect rhexis over there. So in the second picture, the force which you're using is more like a stretching force. You're trying to make you're trying to go along the border of the, along the circle of the iris and then making it. In the third one, when I was not able to make, I was trying to use the shearing force to actually move it inside. It is more like a centripetal force. Do observe, I had a difficulty because I was using a Capsulorhexis needle, but if I was using a Capsulorhexis forceps, probably I could have done it with more easily because I could even use the 90 degrees, the tangential force to pull it. So the tangential force actually helps us out because in this, in a cystitome, you're again using the same radius along the zonulars, so it might not be so good. So in practice, I would still prefer a combination of these two instruments. Coming to a Capsulorhexis forceps, it's a routine thing. You go depth, make a small depth, and then cut the nucleus, and then you make the complete Capsulorhexis. Here when you observe, that you have actually seen that you don't need much of a places to grab the rhexis as such, because it is easier to do it. I'm talking about visco and hypomature cataract. You just make sure that when you're using a hypomature cataract, a lot of people use cohesive OVDs, and you have to make sure when you use a lot of cohesive OVDs, you're trying to push the whole lenticular complex downwards. Indirectly, the pressure, the vitreous also injects pressure, so all these come up, the fluid comes up, and it is actually bad to give the cohesive OVD. There is a spiral rhexis over here, which you can use in a hypomature cataract, which I wanted to show. You can use a combination of devices that will take care of it. There you see, again, visco again. In the third one, there's a double rhexis. Here you created a small rhexis, and then you're extending the rhexis. So thank you, everyone.
For those wonderful tips on Capsulorhexis, which is perhaps the most crucial step in getting a very good outcome in cataract surgery.